Good evening. I'm psychiatrist Jay Fauver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Matters of the Mind is a live call-in program where you decide to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with an email I received this week. It reads, Dear Dr. Fauver, I took Paxil, it's also known as paroxetine, for depression for a little over a year, many years ago. Despite weaning myself off the drug at that time, I still experienced side effects. Is there any way to repair this? Does it put me at a higher risk for eventual dementia? The good news is being on Paxil, going off Paxil, would not put you at a greater risk for dementia, fortunately. But the withdrawal, the discontinuation phenomenon from Paxil is something that makes it unfavorable for many people. Paxil or paroxetine came out in about 1995, and its claim to fame at the time was it was the most potent of all the serotonin medications. And at the time, we were thinking in the 1990s, well, gee, more serotonin, that's even better for some people because higher amounts of serotonin will give you more of an emotional numbing effect. And if you have a lot of anxiety, panic, post-traumatic stress symptoms, it can kind of calm things down. But for many people, they found not only were there drug interactions where it would cause the blood levels of various medications to increase, but also upon your coming off the Paxil, you could have zings and zaps in your hands and feet. You could have kind of a lightheaded feeling, some dizziness. It doesn't usually go on for years, but it can go on for several weeks or even months for that matter. So for that reason, we will often have people slowly taper off the Paxil, sometimes over the course of 1 month, 2 months. I've even had somebody go off the Paxil over the course of 3 months because they had so much difficulty with the tapering of it. Sometimes we'll actually add a medication called fluoxetine, also known as Prozac, as a means of easing some of the discontinuation phenomenon. But more often than not, we just try to do a slow taper on the paroxetine. But fortunately, it does not put you at a higher risk for dementia going through the discontinuation, or for that matter, even being on the paroxetine. Thank you for your email. Let's go to our next email question. Our next email question reads, let's bring it on up here if we could. There it is. Dear Dr. Fauver, are there prescriptions that work well together that treat both attention deficit disorder and bipolar disorder type 2 in adults? My sister was just diagnosed with both. Is it better to start on one medication and then another? Are there other things that can be done to help with the symptoms? Bipolar disorder type 2 means that she's experienced 4 to 6 days of little highs that don't cause a lot of impairment, but they're there. And then she'll crash into 2 weeks of depression or more. So little highs for 4 to 6 days and then depression for 2 weeks or more. You can have those episodes on top of attention deficit disorder. Now, it's very important that you differentiate attention deficit disorder from bipolar 2 disorder. Number one, ADD or attention deficit disorder is a phenomenon that occurs on a day-to-day basis, and it goes back to when you're a kid. So every day you have difficulty with attention span, distractibility, focus, concentrating, persevering, getting things done, getting things initiated, especially if they're not challenging, exciting, or novel and new. So you can have attention deficit disorder symptoms typically on a day-to-day basis. They'll occasionally get worse on days or weeks where you're more challenged by things that aren't so interesting. So people can have a variation of the symptoms, but for the most part, those symptoms for ADD are there every day. Bipolar disorder, quite different. It's a mood disturbance where you can have the little highs and then you have big lows and they come and go. So the treatment priority for ADD, in addition to bipolar 2 disorder, will be, number one, have somebody take a mood stabilizing medication. A mood stabilizing medication would be a medication like an anti-epileptic medication or a dopamine receptor blocking agent. They used to be called antipsychotic medications, but I think the preferable term would be dopamine receptor blocking agent. These are medications that have been out for several years now. They used to be used exclusively for schizophrenia. Now we're using them extensively for bipolar disorder and sometimes as add-on medications for depression. So The first thing you want to do with bipolar II disorder with ADD is treat the mood disturbance first. Get the mood all leveled out, kind of like a cruise control in an automobile. Then, only then, you will then treat the attention deficit disorder. With ADD is a condition where the left front part of the brain isn't working so well, and to some degree, the middle part of the brain is not working so well. So the left front part of the brain is used for distractibility, attention span, concentration. The middle part of the brain is more related to impulsivity and thinking before you do things. And with attention deficit disorder, you have disruptions in that part of the brain especially. With bipolar type 2 disorder, it's more of a mood disturbance. Inner workings of the brain are more disrupted. So with bipolar II disorder, you're going to treat somebody with a mood leveler, a medication that will stabilize the mood like the cruise control. And then with ADD, what you want to do is fire up this front part of the brain. You fire it up with stimulant medications, not uncommonly, the methylphenidate or Ritalin products, the amphetamine products. Sometimes we can use non-stimulant medications with some success. They will affect serotonin and norepinephrine, sometimes dopamine to a different degree. But what you're trying to do there is to fire up the front part of the brain with attention deficit disorder. Now, sometimes you'll hear about people having a lessening of effect for ADD as they go through their lifetimes because they won't have the cognitive challenge and the academic pressures they might have had earlier in life, especially when they're in school trying to remember and learn things that weren't that interesting. When people have attention deficit disorder, they often have almost a hyper focus for things that are really interesting to them, but if they're not that interesting, they just can't focus at all. And that's a challenge for them in school and often in a new job situation. But if you've been on the job for 5 or 10 years, you pretty much have the routine down. With ADD, it might not be as much of a problem for you once you get into your regular routine of life. So with ADD, it might not impact you as much later on. With bipolar II disorder, often it has its onset as an adolescent, perhaps as a young adult in your early 20s. And then you'll have these little highs that might not be too problematic for you, but then you hate the big lows. And when people come to see me about, and they have bipolar II disorder, they'll often complain drastically about the lows, but they won't be so concerned about those little highs. But the problem is if you have those little highs, you're more predictably going to have the big lows. So you've got to get the both of them settled down, and that's where the cruise control comes in. So with bipolar type 2 disorder with ADD, you're going to first use a mood stabilizer, see how much difficulty is still there with attention span and focus and concentration. Then, if needed, treat the attention deficit disorder symptoms thereafter. Thanks for your email. Let's go to our first caller. Hello, Ryan. Welcome to Matters of Mind. Ryan, you'd mentioned that you're having issues with high blood pressure, and you were just cleared to go back to work. What kind of techniques can you practice to keep your stress level down, and how does stress affect your blood pressure and why? Well, stress is basically a change, Ryan. So if you have a change in your day-to-day routine of any kind, you're going to feel stress. So stress isn't all bad. It's just you have to be able to cope with it. You have to adapt to it. Our lives would be really boring if we didn't have differences occurring in our lives, if we didn't have some kind of changes occurring. So, we need to be able to adapt. It makes us sharper and makes us better in our day-to-day functioning if we can be challenged on a regular basis. So that's stress. The key for you is to be able to deal with that stress, depending on the nature of it. Sometimes writing things down, knowing what your priorities might be, getting this done, then that done, then that done in order is often helpful, but many people will get stressed out because they procrastinate. And they'll do a little bit of something, get kind of bored with it, or lose interest, and they go to something else, and then they go to something else. Some of these people do have ADD, to which I'd referred earlier, but if you don't get things done and you keep it hanging over your head and you don't address what you need to do, that's a big stress in itself. So in the workplace, you have to get things done accordingly. Now, you need to be able to compartmentalize your stresses and figure out, and from a prioritization standpoint, do I do this first or that first? And that's often a means of managing stress. If you want some basic behavioral techniques for managing stress, I would suggest taking inhalations and exhalations where you inhale over the course of perhaps 2 seconds, exhale over the course of 4 seconds, because as you're exhaling, this particular autonomic nervous system called parasympathetic nervous system kicks in as you're exhaling, and it actually slows down your heart rate. So you actually are calmer as you exhale compared to when you're inhaling. So inhaling for 2 seconds, exhaling for 4 seconds is one technique. Inhaling for 4 seconds, exhaling for 8 seconds can also be done. But the bottom line is have a longer period of time where you're exhaling. It can calm you down. And then there's a very simple behavioral technique where you put your arms on the side of the chair and you just imagine, starting with your fingertips, going all through your body, you imagine yourself getting heavier and heavier and heavier in the chair itself. It's kind of a technique we used to use with hypnosis, but it's a means of just making yourself very relaxed and thinking about every single muscle fiber in your body and making yourself heavier and heavier and heavier. And in doing so, that is also a means of relaxing. Having maybe 5 minutes during the day here or there where you're not really thinking or focusing so much on your day-to-day work activity, you're just kind of going into kind of a meditative state, can be helpful. I'll often tell people when they're really stressed out at work, go easy on the coffee. A lot of workplaces have the caffeinated coffee readily available, and it's great for waking up the brain some, but when you already have high blood pressure, be careful with how much of that you're consuming. It's great for focusing and helping fire up the concentration, but if you get a little bit too much caffeine, it can actually make you more anxious. Thanks for your call. Let's go to our next caller. Hello, Deb. Welcome to Mayor's the Mind.
Hello.
Hi, Deb.
Hi. I have a daughter that has bipolar. I just turned you guys on. And I was wondering if the medicine can counteract with her brain.
Hopefully in a good way. Deb, in what way or would you wonder how the medication is working on her brain?
Okay. She gets snappy. That's the only way I can say it. 1 minute she's real nice, and then all I can say is she's snappy. See, because I have seizures, so I know what my problem is. But she was diagnosed with bipolar, and she can be really snappy.
Yeah. So why do people get snappy when they have bipolar disorder? Deb, does the snappiness come and go based on her mood, whether her mood's on the high side or the low side, if you can identify such polarity of her mood?
Okay, she's usually in the gripey side, I should say, all the time.
Okay. If she's more on the gripey side all the time, it might not be a direct manifestation of her having highs and lows. Now, it's interesting that you have seizures yourself, Deb, because we see a lot of correlations between a seizure disorder and bipolar disorder. In other words, there's a disturbance of glutamate. Glutamate is an excitatory chemical in this outside part of the brain. We call it the gray matter of the brain. And if you have disturbances of glutamate, it can cause you to have seizures, and it can also give you mood disturbances. So nowadays, we'll treat a lot of people with anti-seizure medications. Even though they don't have seizures, they might have bipolar mood instability. So we'll use medications like Depakote, Lamictal, Trileptal, Tegretol. Sometimes Topamax is used. These are medications that have historically been used for seizures. Now we are using them extensively for bipolar disorder. So there's not a direct correlation genetically between seizure disorders and bipolar disorder, but it's a kind of phenomenon where you can stabilize glutamate with seizure disorders or bipolar disorder and thereby get some help. Now, why do you get snappy? Well, again, it comes down to a glutamate disturbance, because when you have a glutamate disturbance, which is a disturbance in that excitatory chemical in the brain, you will have disturbances in how well you're able to control this front part of the brain called the orbital lateral prefrontal cortex. It's right above the eyeball. That's why they call it orbital lateral, just to the outside. Orbital right above the eye socket. But that part of the brain controls your ability to think before you say things and think before you do things. When people have a disturbance with bipolar disorder, often this part of the brain is decreased in its activity, and that will cause you to be more impulsive and more irritable and more snappy. How do you treat that? Well, we will use medications. We'll often treat seizures in the same way, because what we're trying to do is stabilize the glutamate. So from a neurobiological standpoint, yeah, there are mood stabilizing medications that allow a person to think before they say something, think before they do something. But on the other hand, sometimes that's where the counseling comes in to help them try to be aware of, okay, counting 2 or 3 seconds before they blurt out their thoughts about a particular type of situation in which they may encounter, and they need to understand how their moods and how their snappiness will be affecting others, especially their loved ones, because as you can imagine, Deb, when somebody has mood disturbances, they often lash out the most at the people with whom they love the most, because they know that they will be accepting and they'll be able to still be there with them in the end. Well, you have to be aware of that, because it can wear on a lot of people's type of patience as well. Deb, thanks for your call. Let's go to our next caller. Hello, John. Welcome to Matters of Mind. John, you were mentioned that you were recently prescribed propranolol, that used to be known as Inderal, and you're also on alprazolam, also known as Xanax, and fluoxetine, also known as Prozac. So you're on propranolol, alprazolam, and fluoxetine. How do these medications interact? Are there possible side effects? Basically, propranolol is a so-called beta blocker. It blocks adrenaline, and propranolol will decrease tremors. If you get anxious and you get tremors, it'll decrease the difficulty with having kind of a tremulous voice. When you get really anxious, it'll decrease some of the overall tension. It's a good medication to decrease the heart rate when you get in really anxious situations. So we use propranolol not uncommonly for people who have anxiety that's manifested in a lot of physical ways. Propranolol will decrease sweating for people who get really sweaty before they have to speak or they have to have a performance. The biggest drawback of propranolol, John, is that if you get too much of it, it can slow your heart down too much and can cause you to have a lower blood pressure. That wouldn't be good. So that's something you have to modulate. Alprazolam is something that's been used since 1983, I think it came out. It's been around for a long, long time. It was an alternative to Xanax, it was an alternative to Valium. So alprazolam, also known as Xanax, was an alternative to Valium and Librium because they were more sedating. Xanax or alprazolam isn't as sedating as Valium and Librium were, but it did cause the potential for getting used to it and needing higher and higher doses. We used to use it extensively back in the 80s, 90s, even early 2000s. Nowadays, we're trying to get away from using alprazolam or Xanax because we realize, especially as people get older, they'll have trouble with memory impairment. And it's something that's not recommended long-term now. So alprazolam or Xanax can be used short-term, maybe no more than 2 weeks at a time for some people. Higher doses, you can get used to it. You can feel kind of mentally dull in some ways, and it will affect your concentration. In other words, your speed of processing with alprazolam will slow a bit. So it'll feel like your brain has slow internet speed. So alprazolam has those drawbacks, so you want to use that sparingly. Fluoxetine, also known as Prozac, is the third medication you're taking. It's increasing serotonin, among other things, but mainly it's increasing serotonin when you're using it for anxiety. It's a medication that can be used safely long-term. It was originally used as an activating, energizing medication that increased serotonin. Has an extra feature where it will help you lose a few pounds because it suppresses the appetite. But increasing serotonin will give your brain kind of a calming effect. It has kind of an emotionally calming effect. For some people, it'll make them not care. And that's not good for some people. That's the biggest side effect of fluoxetine or Prozac or any medication that increases serotonin. It can make you not feel happy, not feel sad. You just don't feel anything. And we call that emotional blunting, also known as alexithymia. But it just makes you not care about anything. We don't want that. That's a side effect we're trying to avoid. But alprazolam, propranolol, fluoxetine, they all work in different ways. Fluoxetine will increase the blood levels of propranolol a little bit. So 10 milligrams of propranolol might feel like 20 milligrams. That's the biggest direct drug interaction. We call that a pharmacokinetic drug interaction. But overall, those medications can get along just fine. I would just suggest, John, if you can, try to go easy on the alprazolam or Xanax especially. John, thanks for your call. Let's go to our next caller. Hello, Katie. Welcome to Matters of Mind. Katie, you want to know, when does having trouble sleeping turn into diagnosed insomnia? Basically, if you're not sleeping well, Katie, you'll feel tired the next day. You'll have trouble with concentration the next day, and you won't feel like you had a decent night's sleep. Now, most of us have cell phones now. And if you think about it, when you're charging your cell phone, if you're not getting a good charge on your cell phone, or let's say your battery on your cell phone is starting to go bad, you'll notice that your battery lasts maybe 4 to 6 hours. It doesn't last the whole day, and you have to keep recharging it. Well, that's what happens to your brain. If your brain doesn't get adequately recharged at night with two very important phases of sleep, there's a non-rapid eye movement sleep and there's a rapid eye movement sleep. It's called non-REM and REM. And the non-rapid eye movement sleep is where your whole body is getting very relaxed. If you get awakened during non-REM, which is what's occurring within 30 minutes of your going to sleep, if you get awakened during that time, you'll be kind of confused for a few seconds because you're going into a very deep sleep. That's called non-REM. That helps your body physically recharge. And then there's REM sleep where you're dreaming. REM sleep, your body's paralyzed during that time, but if you're awakened, you're going to be alert and awake, but you're dreaming during that time, often very abstract dreams. When you dream, that actually helps with your memory, and you are shutting down this left front part of your brain here that you use for intense focus and concentration throughout the day. So in doing so, you're giving that thinking part of your brain a rest when you're in REM sleep. So if you've gotten your non-REM sleep, your body feels refreshed, your REM sleep gives your brain refreshed. You need both phases of sleep to really feel like you slept well. If you don't, you have what we call functional impairment. You feel like you are not as sharp the next day. You'll feel like you just can't get things done as well. You'll have to have frequent naps. You're always tired. Now, there's a lot of things we'll examine if people are having those kind of symptoms. We'll look at your thyroid, sometimes your iron, especially a woman who's heavily menstruating. We will look at glucose disturbances, sleep apnea, something we're often trying to identify because it's so readily treatable. Sleep apnea is where you might be snoring or pausing your breathing at night, and it's not allowing you to have a good night's sleep. But basically, insomnia becomes problematic when you have what's called functional impairment. You're not able to get the things done the next day that you'd like to get done. So you're not able to socialize, you're not able to think, you're not able to focus on things, you're not able to do well in school, you're just not able to get the things done you'd like to do. That's called functional impairment. That's where you have a diagnosable insomnia itself. Katie, thanks for your call. Let's go to our next caller. Hello, Caleb. Welcome to Matters of Mind. Caleb, you'd mentioned you're on sertraline, also known as Zoloft. Sertraline for anxiety, and you're having intense stomach pain. Is that from the medication or your anxiety? It depends on what started when, Caleb, because sertraline increases serotonin. Serotonin is in the whole body. 90% of the serotonin in your body is in your gut. So if you have anxiety that causes you to have stomach pain or stomach aching, actually taking a medication like sertraline can relieve some of that by going to the brain, enhancing serotonin in the brain, and giving your brain a calming effect. The brain is connected to the gut is connected to the brain, and if you have a calming sensation in the brain, you'll have less anxiety in the gut and less stomach aches. So sometimes, it's a matter of what came first. If your anxiety previously was manifested by gut aching, sure, the sertraline can actually help with that. However, if you never had any stomach problems before, all of a sudden you're taking sertraline, increasing sertraline can indeed stimulate certain receptors in the gut for serotonin that can give you nausea and sometimes diarrhea, and those are side effects we often hear about early on with sertraline. It's related to the dosage. The higher the dosage, the more of those type of symptoms. So we'll often have people take lower doses with food because food will slow the absorption, give your gut a little bit of a coating effect, and it'll decrease some of those side effects. But with time, often those side effects do decrease. But Caleb, anxiety can be manifested by gut pain. Sertraline can cause gut pain. So it kind of goes back and forth in terms of which started. Thanks for your call. Let's go to our next caller. Hello, Tina. Welcome to Matters of Mind. Tina, you want to know if technology can be an addiction whenever you take it away from teens electronically, they lose it. That's not a good sign, Tina. Yes, technology is very smart because technology, with social media especially, has algorithms. You may have heard about them. Algorithms kind of get to know what really interests you. And the thing about any kind of addiction is you're firing up, this is the front part of the brain looking at you. I took the brain apart. And here is called the nucleus accumbens. The nucleus accumbens will fire out dopamine when you're getting excited about something. New, exciting, novel type of experiences will fire out more dopamine. And the only way to fire out more dopamine after repeated experiences will be to do something that takes it up a notch and can be even more exciting. And in social media and in gaming, those type of experiences with technology, you can sometimes need that greater thrill, and it's a problem where if you try to take it away or step away from it, you get very anxious and irritable. Not a good sign. There should be a time limit, and your teen should know that ahead of time, that they're only going to have a certain amount of time to be on the social media. They have to get away from it because the addictive nature of the technology pulls them in and will cause them to actually have mood disturbances if they're on it too much. Cell phones were fantastic when they first came out. Tremendous tool, and have all this technology and information at our fingertips, but the problem is it can be troublesome in terms of being able to pull away from it, especially if you're using it late in the evening and it's impairing your ability to socialize with other people. Tina, thanks for your call. Let's go to our last email. I think we have another email coming in here. Here it is. Got about another minute here. Dear Dr. Favre, are there new directions in the treatment of psychiatric disorders that are emerging in the coming years? It seems like there hasn't been any progress in psychiatry like there have been in other medical fields. I think the new direction we're going to be hearing about in psychiatry over these next few years will be this whole concept of being able to treat stress resilience difficulties. In other words, stress resilience has to do with how well you're able to put up with stuff. I mentioned earlier the whole concept of stress being you're having difficulty coping with day-to-day changes. Well, that's called stress resilience. And I think that's going to be the focus we're going to be seeing. And with improved stress resilience, people will be able to function better with their social environment, their work environment, and their school environment. So I think stress resilience is something we'll actually be measuring. There's a test called a Connor-Davidson stress resilience test that has come out that we're going to be testing more and more people on. Thanks for your call, Tina. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you may write me via the internet at mattersofthemind@WFWA.org. I'm psychiatrist Jay Favre, and you've been watching Matters of the Mind on PBS Fort Wayne. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
Preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.